I wasn't eating right before cancer, and now you want me to eat right now? Good luck with that.
If you would like to support the Everything Cancer podcast, there are links in the show notes to our Patreon page and our website. Welcome to the Everything Cancer podcast, the empowering extra-large suitcase of the cancer journey. I'm your host, Jill, longtime oncology certified nurse and cancer support group facilitator. This show is designed for survivors and those who love them, and to offer providers insight and fresh perspectives. The information shared on this podcast is not intended to be used for medical advice. For any healthcare concerns you have, please consult with your healthcare team. The staff at Everything Cancer Podcast will not be answering individual healthcare concern questions. Hello, everybody, and welcome to the Everything Cancer Podcast. We have a very dynamic guest with us today, Dr. Veronika Panagiotou, and she has her PhD in community engagement. She is exceptionally talented at that, which I have learned through many experiences. We have so much to talk about today with her. She has so much to bring to us. Thrilled to have you here, Veronika. Thank you.
Thank you so much for inviting me. It's a pleasure.
Believe me, it's my pleasure to have you here. Can you share with us what your position is with NCCS and how you became involved with NCCS and what the NCCS is?
So I am the Advocacy and Program Manager at the National Coalition for Cancer Survivorship, NCCS for short, because that is just a mouthful. And really, it goes along with my cancer story, so it works well there. I, at 25, 10 years ago, was diagnosed with non-Hodgkin's lymphoma in the emergency department because I did not have health insurance at the time. And the reason, if we remember back 10 years ago, in the landscape of health insurance is very different than it is today. Today, we have protections because of the Affordable Care Act that students can remain on their parents' health insurance until 26. And so that provision would have protected me as a master's student to be able to stay on my family health insurance plan. But that wasn't the case back then. So I was booted off when my family switched plans, when my mom switched employers, got a new plan, and that plan decided that they weren't going to cover me at 25. I was almost done. I was a master's student at the University of Pittsburgh. I was studying applied developmental psychology, and I was learning how to assess development in chronically ill children. And I volunteered for 2 years at Children's Hospital of Pittsburgh on the oncology unit. So I worked with those children in Pittsburgh that were diagnosed with cancer. I was supporting their development and helping them get through the trauma of healthcare. And that was my role. That's what I was studying to be. It was October, my last semester. And I said, I have 3 months until either two things happen. Either I get a job in January, or in January of 2014, the Affordable Care Act exchanges on January 1 would go into place. And so I could buy a healthcare plan at that point. So I had 3 months where I was like, I'm going to risk it. I'm young. I'll risk it. In that 3 months, I would be diagnosed with cancer. I experienced my first 30 days of treatment. I was diagnosed on December 2nd. So I experienced those first 30 days without health insurance and what that was like. And then on January 1, I also, at the time, the limits on what your assets were. So I didn't even qualify as a student for Medicaid either. So I did that first 30 days without insurance. And January 1, I was able to use my Affordable Care Act plan to use for the rest of my care. And let me tell you, it was a night and day difference in how I was treated and what I had access to. Even with a high deductible plan from the Affordable Care Act, I had that. I like to say it was like my magic ticket. It was like Wonka. Like I had access to healthcare. And so I was able to get through my treatments, 6 months later considered no evidence of disease, and was so grateful for that. Fast forward in 2017, there was the fight to repeal the Affordable Care Act. And I was working at the time. I was attending CancerCon, the Young Adult Cancer Conference. And one of the main speakers at the conference that year was Shelley Foldnasso, the CEO of NCCS. And she talked about, rallying the troops of we have to use our voices. We cannot get rid of the Affordable Care Act. And I'm sitting in the audience and I realize that my story met that moment in history, in political history. I had the perfect story. Mm-hmm. That piece of policy changed my life. It gave me access to care. I volunteered. I went to Washington. I shared my story with Senator Bob Casey and his staff. And he said, "Oh, I'm doing a media event in Pittsburgh. Come join me." So I joined, not knowing that he would have every media outlet in Pittsburgh. Every form of media, newspaper, TV, local news. I mean, craziness. And I get up, and NCCS gave me the skills and looked over that speech, and I was able to share with Western Pennsylvania how important the Affordable Care Act was. And I got the policy bug, I like to say, in that moment. I then also, in that time frame, was trying to find my joy again, as many survivors come out the other end and they don't feel the same. They have different priorities, different values, and just beat down. And realizing that I couldn't assess the development of chronically ill children because I couldn't be the happy person, because I knew what pain and suffering that those children, I couldn't fake that. I couldn't fake recognizing that they were suffering like I had suffered. I mean, you suffer. I mean, that's, to get through to the other end, you have to experience pain. I mean, that's without question. It's not easy. No cancer is the good cancer. And so I went back to school to get my PhD in community engagement. And a part of that program happened to be policy and advocacy. So I got now the skills to be able to do this work, not just the lived experience to do this work. And I happened just magically, the program and advocacy position opened up when I was done with my program. And I took that as a sign that this is where I should be. And so that, long story short, that's how I became running the programs and bringing advocates to Washington, just like Shelley had brought me to Washington all those years earlier. And it's been 3 lovely years, and there's lots more to do.
But you've made so many strides. My gosh. I have gone through the NCCS website so many times. It is such a go-to for me when I'm putting together presentations for people, materials for people. The amount of information and the quality of information on it and the way it's written is wonderful. So thank you. And so anybody that's listening, I encourage you to go there.
Canceradvocacy.org. Cancer Advocacy. Or we have our resources, survivorshipchecklist.org, that you can find our survivorship checklist, which is our right now our go-to resources. And knowing, so the National Coalition for Cancer Survivorship was started in 1986 by cancer survivors for cancer survivors. Mm-hmm. And so all of our resources are created by cancer survivors as well. So that's why they're so accessible, and we get so much input into them. So know that clinicians look at them, but also survivors who have that expert experience we run them through at, different groups of people, diverse cancer survivors. Because we at NCCS serve in survivorship all 18.1 million cancer survivors. So our goal is to make them Sometimes it's a little frustrating because they don't have all the answers. And I will say that too, because we want to give you the questions to ask your providers and your communities if those resources are even available. It gives you an idea of what to look for and what to ask. And truly, survivorship, the most frustrating part for me as a survivor is survivorship tends to be piecemeal at best. Our resources give you the tools to ask the questions. It gives you the path and the journey, which is so important. It gives you the tools to communicate.
It gives you the map to communicate. Right. So can you take us on a tour of the survivorship checklist? Because it is such an important resource.
Absolutely. So our survivorship checklists are broken up into 3 parts currently. They are the in-treatment checklist, the post-treatment checklist, and the third checklist is for those living with metastatic disease. So those that won't see the end of treatment will continuously be in some part of treatment for the rest of their lives. Basically, a snapshot of what those checklists look like. In treatment, I would say the theme of it is finding the plan. Do you know your plan? Do you have documentation of your plan? And what supportive services are going to get you through your treatment? These are some ideas. And then what are the roadblocks? Financial roadblocks, work roadblocks, school roadblocks. So how do you navigate those roadblocks? Do you have policies? What policies do you have? What can get you through financially this time in your life also? So it gives you, do you know your plan? Are you organized about your plan? Things can help me get through my treatment plan. What are the roadblocks that you might get that might hinder you getting through your treatment financially? So that's what's the in-treatment. The post-treatment plan is, again, do you have a post-treatment plan? And what does that look like? Not treatment, but how you're going to live your life. How are you going to deal with medical things that come up post-treatment? How do you deal with those? And I said, I wasn't healthy before cancer. And now you expect me to live the principles of a healthy life now? Like, I'm even more frustrated and more fragile. I wasn't eating right before cancer, and now you want me to eat right now? Good luck with that. The next plan. What are healthy behaviors that we can adopt to better live? How do we deal with all of the trauma of cancer treatment? So psychosocial support, mental health support, things to think about. Now that we've survived, now we have to dig out. What are our options there? Now we might not be the same human that we were before cancer, and work and school might be harder. So are you thinking about those accommodations that you need post-cancer life? And how do you get back on the journey that you were on? That's important. Those are all things to think about. And then also, what are we at risk for? And how can we reduce our risk? Are we thinking about, do we all know that we're at greater risk for more cancers? That's a big thing too. Do you have a plan in that regard? The services at NCCS that we really focus on that complement cancer care: palliative care, integrative oncology, integrative care, and cancer rehabilitation. How is our physical body faring? How's our muscles? How are all those basic functions that we need? How are they working now post cancer? And there are therapists to help you with that. So that's the post treatment checklist. Those living with metastatic disease, I think, is a good combination of the in treatment and post treatment, because those living with metastatic disease need everything that those in treatment and post treatment need.
Yeah,
they are equal. They are not less than. They deserve every resource that those post-treatment deserve. They deserve it while they're in treatment. So that's baseline for us. And if you hear their stories, they struggle to get those resources. So we want to make sure to emphasize for them that you deserve those resources. So that's on the checklist. But the other part that we focus on in that checklist is leaving a legacy and doing it before it's too late, and having the tough conversations with kids and with family members about the realities of their choices for the rest of their life and what time they have. Creating, videos or cards to leave, letters to leave behind. Do you have your all that legal stuff, estate planning done? How do you want to live the end of your life? How do you want that to be? And thinking about that. That is also in that checklist. So those are the 3 checklists that we have that are for all cancer types. We will be rolling out checklists that are more disease focused. The first one will be head and neck cancers. So it is a deep dive in those with head and neck cancers, more options for them and things to consider as a head and neck cancer survivor who get chemo, radiation, and surgery. They typically, in some form or the other, they get all 3 of the whammy, I like to say, depending on their diagnosis, needing more of those. And so
they have a lot of challenges. Yeah. Yes.
They have bigger needs. Oh, the needs of those with head and neck cancers is extraordinary, but we don't hear much about it. And so there's some research that says that those with head and neck cancers have higher suicidality than most. And so that's alarming to us as well. And so we took that group to really create a checklist that would give them a little bit more support than our basic checklist.
So you mentioned 2 things that I'm very interested in for everyone, and that's integrative oncology and palliative care, both of which can help a great deal with the symptoms that people are experiencing both during treatment and after treatment. And can you talk, Veronika, a little bit about what each of those disciplines can do?
Integrative oncology, and maybe it has, some people consider it alternative, and you throw that word around, which I would not throw around with integrative.
I agree.
Integrative is complementary, and that's how we like to think about it. It complements your medicine and treatment and drugs. It complements those. Integrative therapy modalities or types can be acupuncture. It can be mind body. It can be meditation. It can be yoga, just exercise under the cancer umbrella is supported within that discipline. Nutrition. Sleep. Yes. Sleep is a huge component of that as well. We could put aromatherapy in there. I mean, we can go on and on and on. And I will pause and say that NCCS has a lot of webinars on these topics. And so if you want a good deep dive into the research or the evidence, sometimes there isn't enough research. And that we could talk about that forever, that there is not enough survivorship research. And that hinders people getting access to these things because we want these modalities to be evidence-based. But we know that we just need more time to study them to know if they work well or not.
There is a lot of good information on the mind-body connection.
Yes.
Through the NCI, they're seeing that people are doing much better with their treatments and symptom management. And after, with quality of life, when they do concentrate on mind-body connection and exercise, you cannot underestimate the power of exercise during treatment with fatigue management, symptom management, and quality of life. For so many reasons.
Yes, I guess people don't realize too, until you've gone through some treatment or a provider who provides that treatment. Treatment is not easy to get through.
No,
and many people stop and cut or don't get enough of the dose because they just can't get through it. And integrative oncology and all these things that we talked about, pain, neuropathy, all of the nasty side effects, the nausea, right? How can we eat so that we can eliminate as much of that nausea as possible? Or people that are on steroids who are eating because those pills just drive you to eat. What healthy choices can we mitigate some of that added weight, right? Like thinking about trying to come out the other end in the best possible way, right? So that we haven't lost all our muscle mass, or, because then we can't lift our arms to wash our hair. I mean, that's a real thing that people lose so much of their physical body in cancer and in treatment. Integrative oncology helps support patients to get through their complete treatment, but also be able to function on the other side. And that really is the base of the goal of that discipline. And then when you're ready, and I like to say it took me 10 years post-treatment to be ready to think about, maybe 9 years, to think about how I want to be a healthy person. And many of the things in integrative oncology, I don't need the intensive that I might have needed in treatment, but all those things can support me in healthy living. They complement my healthy living. So they continue through the end of your life to be able to support you and your whole body. And that is holistic and what people talk about. Palliative care has many modalities as well. And it sometimes gets confused with hospice or end of life. And that, even though palliative care physicians understand hospice and end of life planning, that doesn't necessarily mean that you are going to receive those modalities with that service, right? Palliative care, they have a huge focus on pain management. They too have a huge focus on mental health and referral out. They also, for those who are in a more serious, I don't want to say end of life, but are dealing with a lot of complications. Their goal is to improve a person's overall quality of life. So that might mean, I have a story of a breast cancer survivor who didn't want to go, first of all, didn't want to believe, didn't want palliative care because they didn't want to be seen as someone who was dying. And so they didn't want to go, but they went. And the palliative care doctor talked about, like, what are the stressful things in your life right now that is hindering your ability to fight this cancer. And she talked about what she was really worried about. She was a single mother, and she was worried about the custody of her child if she would die of cancer. And so that palliative care doctor was able to provide her resources for legal aid to be able to reduce the stress and the uncertainty of custody of her child. So they are all about providing resources to reduce stress in full life circumstances. That's one example. But they are overall interested in your quality of life and doing what they can to support that and being innovative in that.
They're very innovative, and they think outside the box in terms of symptom management too when you're going through treatment. Yes. If you're on a really tough treatment or you are recovering from a really tough surgery, along with integrative oncology, a lot of times and especially if you're going through radiation therapy, they can be very helpful in terms of getting around, just if you're losing a lot of weight, helping you figure out ways to keep weight on so that you can stay, like you were saying, Veronika, more robust through treatment. They're just great people to know and to involve and to talk about what's important to you at any given time. So if getting to work every day is really important to you because you have to maintain benefits, but your treatment is getting in the way of that, they're a really good, because they're interested in quality of life, they're a good resource to talk with and talk through that with and kind of figure that out and then pull your oncologist in.
Right.
And they may come up with something creative to help you do that.
Yeah. And I think too, the reality is not everybody is going to find integrative oncology and palliative care in their hospital. They might find one or the other, right? And so they kind of overlap a little bit. And that's okay. Because we're talking about pain management. Well, integrative oncology does a lot of pain management.
Yes, they do.
But you might not have any integrative oncology providers within your city or community. And so palliative care also has the expertise in that area of quality of life. They're both quality of life disciplines, and work well to support the overall well-being of cancer survivors.
I knew someone who was housebound after colon cancer treatment with diarrhea and could not go back to work and was not getting assistance from her PCP or her oncologist. And I asked her, have you seen a palliative care specialist? And she said, well, why would I want to see them? They're for end of life care. And I said, they're very good with symptom management. At least try. And she did. And they got it under control and she got out of the house and back to work.
Yeah.
And so it just goes to show that thinking outside the box with who you see and pulling in any resources you can be really helpful. And the pages you have devoted to integrative care, integrative oncology on your website and talking about palliative care are great. I'll have links to the NCCS website and to the checklists too. And then I'll also include the link that you have because it's so rich for integrative oncology. You have an excellent explanation of it. So it's really helpful for people to look into and understand it. So thank you for that explanation. That was so helpful. Really appreciate it, especially from your perspective. So what are some stories that you have, Veronika, of how NCCS has changed things on the national policy level for people? And then, if you don't mind, any personal stories that you know of on how NCCS has changed something for somebody?
So NCCS has the mission of advocating on behalf of all 18.1 million cancer survivors in this country. Yeah. And it is continuously, the number is going to skyrocket because the treatments are getting people on the other end. They're getting them to the no evidence of disease. And those also, there are lots of treatments for some cancers that continuous treatment is extending life as well. So we're making sure that the national policies that are implemented by our government have the patient voice and are informed by the patient voice, because that is so important to make sure that people that are making up all the rules and regulations understand the impact of their decisions. So at NCCS, we, since 1986, have been advocating in the legislature for bills that will support cancer survivors across the country. If you've turned on the television recently, you know that process is slow, stagnant, frustrating, but that's the case. So we do that constantly. We're constantly working with our legislators and going to the Hill and telling our stories to have some influence in how our legislators pass bills that will positively impact cancer survivors. But that can be a very slow process. So what else do we do when we're waiting on our legislators? Well, I want everybody to realize that government agencies have a huge impact on cancer care. And those government agencies are the FDA, who regulates the medicines and the devices and the lab tests that we all depend on to work and to be safe. The CDC, the Centers for Disease Control, creates cancer care plans in collaboration with every state. And your state has a cancer care plan that is unique to your state population. And your health departments have that plan, are trying to implement to improve your quality of life and to reduce your cancer risk and everything in between. Every state is working with the CDC to do that work. So we are there's a national partnership as well that NCCS is a part of to help states implement those plans. We do that work. The academic medical centers and drug companies do a lot of research, but so does the federal government. Lots of research. And they actually have a specific cancer institute to do cancer research. NCCS, many years ago, they did not have a office of survivorship research. So we were able to advocate, and an office and a budget was created to study survivorship. We need so much more survivorship research. So we are in collaboration with that office to make sure that their research is meeting the needs of cancer survivors through the end of life. So that's super important. Then you have CMS, which is the Centers for Medicare and Medicaid, is the biggest health insurance company, essentially, who insures everyone over 65. And they make a lot of decisions about how that population receives their cancer care. And so working with that government agency is very important because most cancer survivors are actually over 65. The majority of them. And so making sure that physician reimbursement remains adequate so that you receive the care that you need. So we look at reimbursement a lot. And then Centers for Medicare and Medicaid also do innovative research themselves around different ways that you receive the care in hospitals. And so we make sure the patient voice is there as well. And finally, not surprisingly, but it was surprising to me, the Department of Defense actually does the most cancer research, as their ability to protect us as a people, because it's a national security threat. And so we also provide advocates or reviewers to participate in their research process to make sure that they're studying the right things. And so, so our government really is touches everything in cancer. And so we make sure that the patient voice is recognized in all of those spaces, as well as HHS, which is the overarching agency as well. And so it's important. And before I worked at NCCS, I didn't realize that. Right. I just thought that the bills, that's good. But no, it's a lot of work and a lot of relationships and collaboration to make sure that decisions don't have a negative impact on us. And then finally, also in the other two branches of government, we have the Cancer Moonshot at the White House, an initiative. So we collaborate with them in the work that they're doing. It's very important. And the influence that they have to change the system. So we want to make sure that the voice is there as well. And finally, our judiciary makes a lot of decisions that impact healthcare. Not that we have greater influence, but we monitor those decisions. And then we prepare for the impact of those decisions.
Uh-huh.
And then we leverage what legislation do we need? What kind of regulatory policy do we need to mitigate the positives or the negatives there? So yeah, we're keeping our pulse on every level of government and how they impact cancer survivors.
Wow. That's a lot. That is a lot. And thank you for being there for all of that and making sure it's all addressed. Yeah. That's tremendous.
I will say that policy is slow. It is a frustrating. It is not something you just go in and you make a quick fix. It is the long game. It is the long game times 1,000. And so people can get a little frustrated with that, right? And in the meantime, NCCS is working with advocates across the country because their stories matter. Uh-huh. Change how all of this works. Uh-huh. And we have to continue to, it's kind of unfair that they expect us to be professionals almost, right? To be the professional advocate, to have the public speaking skills, to have the media skills, to have all these skills so that we can be at the same table. And so that's at NCCS. That's what I work in my advocacy space of making sure that our advocates have what they need to be able to influence the change that needs to happen.
Well, one of the ways you make a huge impact, and probably when it was first started, I don't even know if NCCS realized how much of an impact it would have, is the survivorship survey. Mm-hmm. Because my gosh, the number of people that you have answer that gives a true look into what is going on. So can you explain to our audience and to me what this is and what it looks at?
Research is important. Bottom line, we do not theorize. I do not theorize what's important to survivors across this country. I have my story and my perspective, but I cannot touch and hear as many stories as I need to do my work. And so NCCS, everything that we do, the stories we share, the policy, the remarks that we send to policymakers, that we send to the FDA, it all has our research in it. And that's important. So the survivorship survey, we've been doing it, I believe, over 5 years now. Every year we survey across the country. We make sure that we hit all the demographic. We make sure that we location-wise, socioeconomic status. We make sure many advocates in the cancer space tend to be female. And so we make sure that we have good male representation. We make sure that we have ethnicity, diverse ethnicity and race. And we oversample, actually, based on population to make sure that we have an adequate representation of what that looks like. And we overrepresent young adults as well in our survey typically, because if you look at, and I chuckle as a young adult cancer survivor, sometimes I think that we are such a majority of cancer survivors, but when you look at the circle, actually young adults are considered in the minority of cancer survivors. Most cancer survivors are over 65. And so we make sure that we boost the young adult voice as well to make sure that they are statistically significant within the pie. So that we oversample. And we also oversample for those living with metastatic disease as well. So we oversample there too, to make sure that we balance out the typical most cancer for men is prostate cancer and the most cancer for women is breast cancer. We make sure that we balance that out a little bit. And so that survey starts at NCCS. We say survivorship starts at the moment of diagnosis. So we actually back up a little bit and we want to know how you become diagnosed. Because we found one year that we specifically broke it up into stages, that depending on how you're diagnosed and your trust with the healthcare system, that trust that you develop in that moment correlates with your satisfaction all the way through. So if you have a bad experience getting your cancer diagnosis, those survivors are more likely to receive poorer care because there's a lack of trust. And their quality of care and their quality, they rate so much lower. So it's compared to those who say, oh yeah, I had a great experience getting my diagnosis. Everything worked out. And then we got right into treatment. No problem. If you don't, then it's a little hairy. And that's where we see the disparities and we see the gaps and them not being taken care of well because the communication's not there. And the trust isn't there. And there's already other mitigating factors also in there too. Your socioeconomic status, your ability to access resources, all the normal things. And then you have one bad experience and it plummets how you navigate the system. So let me back up. So what do we look at? We look at that moment of diagnosis. We look at treatment, coordination of care, your symptoms, what you experience, how they're mitigated. Is it done well? Then we look at the post-treatment drop-off, we like to call it, or the transition from treatment to non. Very chaotic. We ask about symptoms. We ask about who do you see. We ask about the quality. Did they meet your needs? If you met with a nutritionist, did they meet your needs? That's the next question. Not just did you were referred to them, but did they meet your unique needs? We study that. We then we're beginning to look at survivors that are 5, 10, 15, and 20 years out. What are they dealing with? What does their survivorship look like? And that is a mixed bag. Where are they getting their care? We ask all of those questions. We then ask about the costs of cancer. And we break it up into 3 parts. Your physical costs to your body, your emotional or your psychosocial emotional costs to your relationships, your friends, your self-worth, your mental health, all of those costs. And then the financial costs. So we look at the cost of cancer in 3 huge buckets. Those financial costs, financial toxicity is not just paying your medical bills or your regular bills. Is there food at home? Those costs. Can you make ends meet? We take it a step further at NCCS. We look at financial sacrifices. What have you sacrificed in order to pay for treatment? Your first home, family vacations, your wedding, that first baby. Did we not decide to do that because we couldn't afford it? So we look at deeper quality of life financial issues, essentially choices, but there are no people that do not deserve to be able to be on the same path as their peers that don't have cancer. Not just their ability, like did they drain their 401ks? Things that we sometimes take for granted and we have sacrificed so that we can pay the medical bills. we look at that too. And then every year we look at special topics. We delve into a special topic. One year it was working cancer. One year we delve into the caregiver experience. One year we took a deeper dive into metastatic breast cancer one year. We took a deep dive into racial disparities and health equity one year. A deeper dive. And we deep dived into integrative oncology. So we have a special topic that we delve into each year. But over the 5 years, we've kept that base questionnaire the same though. So we look at the trend. And to be honest with you, it's not getting better.
Yeah.
It doesn't get better, which is so frustrating because of all the progress. And we have made progress in the policy realm. But there are just, every time you turn around, there's just something else that just wipes out the gains of things that we have put into place, it seems like. And so this year, the survey is always English and Spanish. This year, I'm positive we're still doing the caregiver perspective. So we continue every year. It just gets bigger and bigger. This year, we are going to actually deep dive into young adults. And so we are going to partner with Stupid Cancer and amplify young adult experience. And to be honest with you, the young adult experience, all the disparities over these years, the young adult disparity is unmatched, even compared to racial disparities. And it is overwhelmingly, young adults are not surviving cancer well.
Right.
And so this year we've made a point to deep dive into their experience this year.
There is a lot of challenges with young adults, and I'm looking forward to diving more deeply into that in future episodes. And we've talked about it with some of our previous episodes. I'm glad you're looking into that more too and bringing more attention to it. We're almost out of time. Could you share with us quickly the Comprehensive Cancer Survivorship Act and the Cancer Care Planning and Communication Act that you advocated for in DC this past spring?
We come to Washington every June. And so these are two bills that have been introduced in the House. One of the Comprehensive Cancer Survivorship Bill has also been introduced in the Senate. The Comprehensive Cancer Survivorship Bill, to us, is all the gaps in survivorship care that exist today. Everything from research to cancer care planning to employment assistance, making sure that people, if they come out of cancer and they need a new job, they need new training because they can't do the work that they used to do. Making sure that while they're doing that their families are being supported. That's a part of this bill. There's some new care models, some innovative ways to take care of cancer survivors. There is emphasis with pediatric cancer and with children, making sure that they can transition into different types of care and looking at their long-term quality of life. And there are actually 16 total provisions, I believe. It's either 12 or 16. My chemo brain, it could be 12. But there are so many provisions in this bill to fill all the gaps that we currently have in survivorship care. That bill has been introduced by Representative Debbie Wasserman Schultz out of Florida. She's a cancer survivor as well, and is bipartisan. It has also been introduced by Representative Brian Fitzpatrick, who lost his brother to melanoma, cares deeply about cancer survivors. And for him, because we always struggle with the Republican group, and we said to him, what do you say to them? And he said, you say to them that you value people and it's an investment in people. Why wouldn't you? And so I've been thinking a lot about that's what this legislation is for. It values people and their life, and it honors them. It gives them the support that they need to continue on. So that's we brought over 100 advocates to the Hill, and the next step in the process is to get co-sponsors. So essentially, you get your representative to say, I support that bill, it's important, so that in the committees, there are different health committees. If it gets enough support, it needs so many of those co-sponsors to garner support, because there are so many bills. So you have to, that's how they prioritize them. And then they vote in committee to be passed on to the full House, and then it would be voted on by the full House. So the first step is to get it out of committee. So that bill, so that was what we were working on, getting more co-sponsors so that it can get out of committee. And so we've been working on that. The other bill has also been introduced by Representative Mark DeSaulnier. And he, too, is a cancer survivor. There's cancer survivors everywhere. He is focused on one of the provisions, one part of that comprehensive survivorship bill. He is adamant about cancer care planning. And cancer care planning is a tool that providers can give you that has a plan, has your treatment on it. It has all the things that you are at risk for, how to mitigate side effects, and it becomes your plan post-treatment. So a survivorship care plan. And we think that survivors need that tool to be able to navigate the healthcare system. Uh-huh. It's not about it being on paper so much. I mean, it is, it has to be, most people get a plan that they can physically hold. But it's about having all the information you need to be able to negotiate your care and to problem solve your care. We were talking about head and neck earlier. You need to be able to tell your dentist what you've been through. And let me tell you, my dentist isn't connected to my healthcare record. And so you need to be able to share that information, and that plan helps you do that. But physicians need reimbursed to be able to do that. Your medical team needs the compensation to be able to do that. And it creates a code in Medicare and Medicaid. That government agency, right? That big government health agency influences how private health insurers work. So you have to start there. And it would create some reimbursement so that we could all get those plans, and we need those plans. So those are the two bills that we are currently advocating for. But to be honest, I mean, those are our pride and joy. But we advocate for so many bills. There are so many bills out there. One of the bills right now, or one of the issues that we're very focused on, is telehealth reimbursement. That is going to go away January 1, this year, if Congress cannot pass a bill or put a provision in somewhere in another bill to compensate telehealth visits. So the world could be very different on January 1, 2024.
Yeah.
If we don't get that provision. A lot of people over 65 would lose access to their telehealth. So
that's dangerous now.
So we're worried about things like that. That we don't necessarily go to the Hill and advocate for, and don't have a Hill Day around, but that are very important, and there's always
to it, and so on. Is there anything we didn't cover that is really important to you? I know there's so much, but
there's so much. I think I'd like to I always kind of conclude with the idea that advocacy starts with you being able to advocate for yourself, and that's the most important. Can you go into your doctor's office? Are you seeking information, communicating with all the people that need you to get the care that you need, your ability to be able to pivot and problem solve and negotiate. Because the reality is you're not going to be able to get everything that you want. I mean, that's sometimes hard for me to swallow too. But you have to decide for yourself as an advocate for you, what are the top 3 things that are the most important? And that's what you hold on to when you're navigating the healthcare system. And when you become an advocate for yourself and you're strong, confident in it, I guess to say, because even I, who have a PhD in community engagement kind of advocacy, I am at the same mercy as the rest of you. I cannot do it any better. And I sometimes say that some of my friends do it a lot better than I do it. It's hit or miss. And don't get frustrated by that, because you're doing the best that you can within the system that is not doing the best that it can to take care of you, to reach that goal of taking care of you. So do the best that you can. Know that there are then 2 other levels of advocacy. When you become and support others in your local community that need your help, your expertise, your knowledge. And sometimes that empowers us to feel that all this crap that we went through is worth it. When we're able to help others, serve others. And you can do that in your local community. If you do it for one person, it should feel really good. All it takes is one bit of support for someone else to make their journey a little less hard. And then finally, if you decide, and this is kind of the pitch for NCCS, if you decide that you want to speak for and support not just you, not just those in your family or your community, your close knit, if you want to support all 18.1 cancer survivors, and you want to be a voice for all, come join me at NCCS. Our cancer policy and advocacy team continues to work on those skills to be able to be good advocates for everyone. It takes a lot of work because you can't just depend on your story and your experience, but you have to learn about all different types of cancer, all different types of research. And learn about others' experiences, and then channel all of that gusto and advocate for the greater good and for the 18.1 million. So if you'd like to do that, learn those skills, join us on our website, just a form to fill out, and then I will inundate you with opportunities to grow and to learn and to advocate.
I hope that through this podcast, you find some people joining, and thank you so much for your time, Veronika. I so appreciate it. Can't wait to have you back for updates.
Would love that.
The information in this podcast is not intended to be used for medical advice. For any healthcare concerns you may have, please consult with your own healthcare team. The staff here at Everything Cancer Podcast will not be answering individual healthcare questions. Thank you. Take care. We hope you enjoyed this episode of the Everything Cancer Podcast.